नमस्कार. आम्ही आसात हॅलो दोतोर कार्यावळीन. आज आमचे बरोबर आसात गोंयचे नामनेचे नेफ्रोलॉजिस्ट म्हणजे किडनीच्या दुयेंसांचे तज्ञ डॉक्टर शीतल लेंगडे. तुमच्यांनी आमकां फोन करतना तुमच्या घरा कडल्या टीव्हीचा आवाज मातसो कमी करात आणि फोन करात 24904444 आणि 24904445 ह्या पैकी एका नंबराचेर. परतून सांगता फोन करतना घरा कडल्या टीव्हीचा आवाज मातसो कमी करात. डॉक्टर, as we were discussing about the different patterns of the illnesses of the disorders of the kidney, what I want to ask you ki how far or how frequent are the diseases of kidney are common among the younger or the children, and especially my focus is on acute renal failure, and chronic renal failure. Both things I would like you to address this issue.
As far as children are concerned, in children we see something called as nephrotic syndrome. Nephrotic syndrome the child tends to lose a lot of proteins in the urine, and he comes with swelling of his face, swelling of his legs and everything, which is quite common between the age group of 1 to 9 years. And treatment is quite established. If the child is coming on time with medications, the treatment can be done and
taken care of.
Yes.
Yeah. Okay. Any other illnesses common among the kidney among in the younger? In the children.
As you said, is about acute glomerulonephritis,
Yeah.
where there is inflammation of the kidneys, and along with protein, the child tends to pass trace amount of blood, and sometimes you have blood pressure increasing in them, and some hereditary illnesses in the family which can come in the childhood. So.
Okay. Doctor, मला एक सांगा की आपण जेव्हा acute renal failure आणि chronic renal failure, what are these modalities? म्हणजे काय, what is this exact?
Acute renal failure हा असतो की ज्याच्यामध्ये काही कारणामुळे किडनी ही टेम्पररी खराब झालेली असते आणि त्याच्यामध्ये किडनी ट्रीटमेंट आणि ह्याच्यानंतर पूर्णपणे बरी होते. सो दॅट इज कॉल्ड एज अक्यूट रिनल फेलियर. अक्यूट रिनल फेलियरचे सर्वात कॉमन कॉजेस म्हणजे डायरिया किंवा वॉमिटिंग, फीवर, सम मेडिसिन्स एस्पेशली पेन किलर्स, मलेरिया, लेप्टोस्पायरोसिस. तर हे पावसाळ्यात जे येणारे आजार असतात याच्यामध्ये किडनी टेम्पररी आपली खराब होती. काही लोकांना तात्पुरतं डायलिसिस लागतो आणि आफ्टर दॅट दी किडनी रिकवर्स कम्प्लिटली. सो दॅट इज अक्यूट रिनल फेलियर. वेरॅज क्रॉनिक किडनी डिसीज मध्ये किडनी आजार हा आपल्याला 3 महिन्यापेक्षा जास्त कालावधीपासून असतो, मोर दॅन 3 months ड्युरेशन. अँड क्रॉनिक किडनी डिसीज इज नेव्हर क्युरेबल. एकदा तुम्हाला क्रॉनिक किडनी डिसीज झाला तर यू हॅव टू टेक ट्रीटमेंट.
So, according to you, suppose if there is acute renal failure, there are chances of recovery are better.
Yes.
Okay. One more thing I want to ask you. When you take into account of the Goan lifestyle or the food habits or geographic distribution, and especially the temperature around, what you would like to advocate to the people of Goa if they want to take good care of their kidney, to be more precise?
The most important thing is definitely adequate fluid consumption. Adequate, as I said, is anything up to 10 to 12 glasses or at least 3 liters of fluid intake per day. Now, Goan food contains a lot of red meat. We are very fond of eating sorpotel and other things. Now the problem is once you have kidney disease, this red meat contains a lot of uric acid and proteins, which is not good as far as kidney disease is concerned. So we see a lot of incidents of high uric acid level in our Goan population. High level of phosphorus also is very common in Goan population. So when we get these people, we advise them that you cut down on your red meat. They can have fish, but avoid fried fish. You can have curry fish or boiled fish, which is fairly good. And as far as the liquor consumption is concerned, we advise medicinal
Doctor, better you don't advise, because what will happen, people will think this is a medicated this thing, they may go for a longer ride.
For males it is around 120 ml maximum 3 times in a week, and for females it is 60 ml 2 to 3 times in a week. So that is the medicinal limit.
But again, that is what type, how much is the content, what is the alcohol level, everything matters. So best thing we will tell them in general interest is that best is refrain from, avoid.
Maybe have social drinks.
So that at least they should not we have never enjoyed life. So once in a while, as you rightly said, that a social this thing may be permitted within limits. Okay, doctor, we were asking about this. Usually those people, as asked earlier question also, somebody was asking like, what type of diet, because those people whom you get more prone for getting renal stones especially, or unfortunately later on if they are not treated can also lead to the renal kidney disorders. Because even recently I have one of my relative who, I think we have got one call, we'll attend it first. Hello.
Doctor, I want to know the patients, those who are young and having diabetes, maybe little uncontrolled and living a sedentary lifestyle in modern age. So what could be the possible precautions for them to save their kidney in long run?
You have already answered.
That's my question, doctor. Good evening, Dr. Lengade.
Yes.
No, the answer is in the question itself. So when you say sedentary, to be active and lead a healthy life, that is the most important thing. And to have a healthy diet and keep your weight in control is the most important thing.
Correct.
Now there are certain what we call it as golden rules as far as precautions of kidneys are concerned. Now amongst that, the first and foremost is keeping oneself fit and active is very important. Know and control your blood sugar level is very important. Then check your blood pressure and keep it under control. Then as I said, eat healthy and keep your weight in control. Avoid over-the-counter medications, avoid unnecessary painkillers and even alternative medications. A lot of people have that myth in mind that Ayurvedic or homeopathy medicine is safe without any side effect. But unfortunately, we have come across so many people who have taken alternative medications, Chinese herbs for weight reduction, and they cause renal failure. So they are not very safe. They have their own problems.
Drawbacks.
And the most important is avoid smoking. As we said, there is a medicinal limit for drinking, but there is no medicinal limit for smoking. So smoking should be strictly no. Smoking along with lungs and heart, it also causes kidney problems. So stop avoid smoking.
Good, I think you have really addressed this issue. And second thing, very important, there's a physical activity. All this younger generation has, the candidate has rightly asked us about the younger, they should be more motivated.
Fast food should not be.
Yes, fast food, they should live a little more active life rather than sedentary work. Doctor, I think we have got another question. Hello.
Suppose uric acid goes again and again high in the body. So will it affect kidneys?
One of the risk factors
and kidney problems.
Risk factor for having kidney disease. So persistently high levels of uric acid are known to cause kidney problems. We say the cutoff limit for male should be uric acid level below 6.5 and for female should be less than 6. So if the uric acid is going above that range, then along with dietary advice, we give medicines like Xyloric and now the newer medicine which is available for uric acid. So yes, you have to control and keep the uric acid level in check. It is a risk factor for kidney disease.
Achha. Like what do you advise to this patient? Like dietary restriction means what?
Dietary restriction and uric acid, as I said, is meat. Red meat should be avoided. Drinks are definitely there. In certain vegetables, mushrooms and palak contain a lot of uric acid. Dry fruits contain uric acid. So these things
should be avoided. Doctor, this uric acid means apart from, see, initially people usually get with this joint pains. What is the association? Means what are the, how is it that kidney disease are directly getting associated with the joint pains?
Now the uric acid, the way it causes pain in the joints and it gets deposited in the joints. In the same way, uric acid tends to get deposited in the kidneys. In the between the blood vessels and between the functioning units of kidney, uric acid gets deposited, and kidney tends to mount inflammatory response. It tends to sort of drive out the uric acid, and in that process the kidneys get damaged by themselves. It leads to inflammation, it leads to scar formation, and ultimately, unfortunately, the scar in the kidney never heals.
I see.
Yes, and then it causes chronic kidney problems. So especially diabetics, people who have diabetes are at high risk for having high levels of uric acid also. So they are the ones who should be taking proper precautions.
Doctor, so we are talking about this uric acid stone, and means what is the line, like when you feel like this treatment, like apart from this means what is the cutoff point when the treatment like of medical line of treatment, like when drugs should be started for this uric acid? Because
as I said, if the uric acid level is persistently above 7 in males and more than 6.5 in females, we give them a diet for at least a period of 3 to 6 months. we ask them to refrain from drinking, stop smoking, reduce weight if they have excessive weight. And after that period, if the uric acid doesn't come down, then we ask them to start them on these medicines. So once you decide to start them on medicines, we make sure that these medicines are there for quite a period of time. So normally once you start them on these medicines, you have to make sure that the level is controlled and the medicine is taken for at least a year. And then try and reduce the medicine.
Achha. That's all, because often people expect the results to come fast, and once they get the result, they stop also fast. This is a commonly observed sequence of the events. Okay, thank you very much. Doctor, I think we have got one question. Hello? Yeah.
This is Annie. In peritoneal dialysis, some patients have flat tummy and others have fat tummy. Is it because of the fluid or obesity?
The tummy structure is more or less because of the fat and obesity. The therapy per se doesn't change your abdominal dimensions. Yes, it is how you are doing well on the therapy. If you are eating well and if you are feeling comfortable, you will eat more and you will gain weight, which in one way we say is a good thing. But at the same time, if you are eating well and if you are putting on weight, you should also exercise and make sure that the weight is not going out of limits. So some people are born with a pendulous tummy, some people have very scaphoid or well-shaped abdomen. So the therapy per se doesn't change. But sometimes after peritoneal dialysis is started, some people develop hernias. And in those cases, there is a localized bulge. It is not bulge entire. If it's a localized bulge,
it
then
can
you
be
have to be careful. Yes.
Okay, thank you, doctor. I think we have got one question.
I just want to know, doctor, whether kidney transplantation is done in your hospital. Since I have no donor for the kidney, is it possible that kidney is available in your hospital?
Kidney transplantation is started in medical college.
Yeah, at Goa Medical College it has already started. I think we have done
14th October last year, first transplant was done.
Yeah,
and
I think then subsequently there were two more.
Were done. So
yeah, and in fact now, if I'm not mistaken, in September we are planning one more.
Yeah. Now the most important question in transplantation is the availability of donor.
Correct.
Now it is very clear under law that the donor has to come from the family. The patient's parents, brothers, sisters, husband, wife, children, and recently the law has included grandparents and grandchildren.
I see.
Now this is the only family structure or family members who can
permissible
who are legally allowed to donate the kidney. Beyond this, no one else is allowed to permit. So there is nothing like
a kidney available in your hospital and equivalent in that hospital.
Or a friend who is coming, or a kidney bank, or that is not legally allowed, and we have got defined regulations.
Yes, correct. Okay. Thank you, doctor. I think we have got one question. Hello. विचारात प्रश्न विचारा.
डॉक्टर एक क्वेश्चन विचारता. युरिन प्रोटीन प्लस असप म्हळ्यार कितें?
Now normally in the urine
protein plus asल्यार and taka diet कितें?
Normally in the urine protein should be absent. There should not be any proteins in the urine. Now when there is a kidney problem, the urine starts leaking proteins. So then you start having 1 plus or 2 plus 3 plus. Now this 1 plus 2 plus 3 plus is the severity of protein loss in the urine. 1 plus is equal to something like 100 milligrams per deciliter. 3 plus is something like 1000 milligrams per deciliter. If it is 4 plus and above, it is more than 2 grams in a day. So proteins in the urine is indicative of an underlying kidney disease. So they have to find out what is the reason for kidney disease.
Yeah.